Recent increase in opioid-related overdoses, primarily involving fentanyl, has made it a recent crisis, especially in North America. What is fentanyl? Fentanyls belong to a family of very potent narcotic analgesics that are often administered intravenously for general anesthesia. Fentanyl is a Schedule II prescription drug and is typically used to treat patients with severe pain or to manage pain after surgery. In its prescription form, fentanyl is known by such names as Actic, Duragesic, and Sublimase. Fentanyl is a powerful synthetic opioid analgesic that is similar to morphine but is 50 to 100 times more potent. It is estimated that some 100 different active forms of fentanyl could be synthesized. Up to now, about 10 derivatives have been found on the street. Some street names for fentanyl or fentanyl-laced heroin include Apache, China Girl, China White, and Dance Fever. How is fentanyl used? Prescribed by a physician, fentanyl is often administered via injection, transdermal patch, or in lozenges. For illicit use, fentanyl is sold as either a powder or a tablet and can be swallowed, snorted, injected, or put on blotter paper to put in the mouth. What are the effects of fentanyl? Let's talk about effects on the brain. Like other opioid drugs, fentanyl works by binding to the body's opioid receptors, which are found in areas of the brain that control pain and emotions. When opioid drugs bind to these receptors, they can drive up dopamine levels in the brain's reward areas, producing a state of euphoria and relaxation. Common side effects include dizziness, drowsiness, confusion, nausea or vomiting, constipation, and difficulty urinating. Long-term effects include mood instability, reduced libido, menstrual problems, and respiratory impairment. What are the risks of using fentanyl? Since opioid receptors are found in the same areas of the brain that control our breathing rate, in high enough doses, opioids can cause breathing to stop completely. Due to the high potency of fentanyl, any usage may cause this same reaction. There are dangerous risks when taking fentanyl with other drugs. Taking fentanyl and alcohol adds to adverse effects and may increase risk of respiratory depression. Taking fentanyl and antidepressants may result in severe unpredictable reactions. Taking fentanyl and heroin may cause severe depression of the respiratory system, and taking fentanyl and benzodiazepines may add to the sedative effects and diminished breathing. The high potency of fentanyl and similar synthetic opioids increases the risk of overdose substantially, especially if a person is unaware of the presence of fentanyl. Overdoses of these drugs may require higher doses of naloxone to successfully reverse the overdose. Overdose effects include chest pain, slowed breathing, seizure, fainting, coma, and all too commonly, death. What are the consequences associated with fentanyl? Fentanyl abuse causes exposure to an ongoing risk of overdose. The most common signs of overdose are slow breathing or acutely shallow breathing. Other symptoms include depression, loss of strength, muscle stiffness, lack of interest in activities, back pain, and diarrhea. One of the most common side effects of fentanyl abuse is the onset of addiction. When the body continues to receive fentanyl, it naturally makes adjustments. One adjustment is to build tolerance, which then requires an individual to take more fentanyl in order to achieve the desired high. As the fentanyl intake rises, so does the risks of harmful side effects. When a person stops using fentanyl or considerably reduces the familiar dose, withdrawal symptoms emerge. Withdrawal symptoms usually start within 12 hours after the last dose and can last for about a week. Days 1 to 3 will be the worst. Most common withdrawal symptoms include restlessness, chills, irritability, sweating, widened pupils, and overall weakness. Now let's go over the scope of the problem. Research from National Vital Statistics System were able to show that involvement of fentanyl in opioid overdose deaths rose from 14.3% in 2010 to 46% in 2016. That is nearly half of opioid-related overdoses. The escalating death toll from fentanyl and its analogs adds to the urgency of addressing the opioid crisis in multiple ways, from wider access to medication-assisted treatment and overdose reversal, to improved provider education about pain management and addiction, to community investment in prevention programs, all in an effort to ultimately save lives.